Bonsoir, bonjour, everybody. We are live. This is Sylvie with Boutique, and this is my pleasure tonight to welcome Dr. Angelica Maria Hernandez. Hey, Angelica.
Hi, Sonia. Hi, Sylvie. Thank you for the invitation. Hi, everyone. I'm very happy to be here.
So, a few words about, we call her Dr. Angelica, but Dr. Angelica Hernandez. So, a few words about our guest speaker tonight. So, she's a board certified ObGyn and an assistant professor at Storybrooke Hospital and Hofstra University. Also had some hospital privileges at the Good Samaritan Hospital in West Islip and Southside Hospital in Bayshore in New York. So a lot of high credentials. You could see from her accent, and I have mine too. Mine is from France. Angelica's accent is from Colombia. But she completed her specialty residency at NYU, so New York University. And among many other things, she has special interest in adolescent medicine and sexual dysfunction. She's also very involved with charity work and community services like Shelter for the Homeless, swimming instructor. She's been a swimming instructor for disabled and deaf children. So a lot of things that she's doing. But tonight, we're going to concentrate on what she's doing every day is treating women issues. And we're going to talk about those issues because they're actually quite common. And that was very interesting when we prepared that session and to see actually what women were coming up with. So let's dive into it right away. And let me ask you, Dr. Hernandez, my first question. Since you see women, a lot of women every day, they come to consult you for all sorts of things. But besides medical conditions, when it comes to hygiene and daily routine, what are the top issues that they are coming up with?
So it is very common to complain about vaginal discharge, foul smell, and vulvar and vaginal itch. Remember that not all the discharge are abnormal. When women are ovulating, that usually happens in the middle of the menstrual cycle. The discharge is clear, is thick, doesn't have any odor or itch. Before the menses, the vaginal discharge could be yellowish or kind of stain the underwear, and that's normal. But it also can be caused by infections, and the three most common are the bacterial vaginosis, that is part of the normal flora, and the symptoms are vaginal discharge and fishy smell. The yeast of the vaginal candidiasis is the second most common, and the symptoms are vaginal discharge, itching, swollen, and sometimes painful intercourse. And the third one is trichomonas. That one is a sexually transmitted disease, which is caused by a parasite. And out of the three, this one, the partners have to be treated. And the symptoms are vaginal discharge, fishy smell, itching, and postcoital bleeding or bleeding during intercourse. So another causes of vaginal discharge could be chemicals. So since our younger age, we've been told that we need to clean because the vagina is smelly and it's dirty. So women sometimes keep cleaning all the time since the morning. And not all, remember the vagina is a mucosa. So the same thing as the nose produces mucus, the ear produces wax, the vagina produces secretions, and they are normal. So when we use a lot of chemicals, for example, soaps. So when we need to clean with soaps, I recommend it to have no perfume or unscented ones. And the reason is because the vagina is acidic. The pH is about 4.5, and the soaps that they have a lot of perfume, they are alkalines. So when we change the pH of the vagina, we damage the balance that is already in the flora. So the soap needs to be used in the pubic area or the area where the hair grows, and between the gluteus or the tushy. The vagina needs to be cleaned only with water, even the unscented soaps, only in the two areas, nothing in the vagina. So also another chemical that is very common to use is the wipes, the baby or the adult wipes. Even the organic ones has chemicals in order to keep it moist. So if you want to feel clean after a bowel movement, you can use it, but do not use it for the vagina. For example, when we take antibiotics or we use soaps that it has antibacterial, we kill the normal flora that it has the bacteria, and the yeast usually increases. Another issue is shaving. So when you shave, use a gel that it has no perfume, an unscented one. And when you use the razor, it has to be a new one in the pubic area. The one that is used, do not leave it in the shower. The humidity can cause yeast. So just dry it and put it in a drawer. And another issue is the thongs. So women I used to wear the tiny panties or the thongs. And if you do use them, remember that the more that you move, the more is the chance that the stool goes into the vagina. It's a different flora. So if you wear those, change the panty itself or the panty liner a few times a day. And if you're going to do a lot of activities, for example, if you're going to the gym, I'd rather you to have no underwear than to have a thong, because you're going to move a lot. So try not to use it, and always remember that.
Amazing. Thank you for this this first overview. And before I jump to the next question, I want to tell our audience that if you want to ask questions to Dr. Hernandez that she can answer at the end, use the bottom right part of your screen if you're on our website, or the comment section if you're on Facebook. So now, next question. You gave an overview about the what could cause this various issues, but how about everyday care? Is that in question? You mentioned that the fact that we constantly clean and we have to be careful, but are there any also internal factors like menopause or others that are making these issues more prevalent?
Yes, so that's true. So for example, in menopause, the mucosa is thin, and that is secondary to lack of collagen that it happens in menopause because it's low estrogen stage. So it tends to be recurrent or tend to take longer to heal. The same thing happens with the people who have diabetes, because the high blood sugars is a very good culture for yeast. I had diagnosed a few patients with diabetes because they have recurrent yeast infections. And the same thing happens with HIV or any immunodepressive disease in which it's difficult for the body to fight the infections.
I am back for my last question. So in terms of the daily routine, what is it that you recommend? And I know we talked about products. So what type of products should we use or stay away from? Do we need to spend a fortune getting some specific products depending on our age or where we live, the type of the skin type? What is it that you recommend for as products for daily use?
Yeah. So I always recommend anything that is unscented, no perfume. So for example, the Dove have soaps with perfume and no perfume. Aveeno has unscented soap, and I recommend it to use those. So people sometimes use any body wash that it has a lot of perfume for the body, but normally what you put on the top runs down. So the same thing. So if you get used to use anything with no perfume is better. And then sometimes buy Summer Sea for different other soaps for the vagina, and it still is not necessary. So the soap that you use on your skin regular, you can put it in the pubic area between the gluteus or the tushy, and that's good enough. The same thing when you buy something to shave that it has no perfume. You can use any panty liners if you have it. It's optional. There's nothing wrong with it. Just to have no perfume. Same thing with the tampons or the pads, even the gels for lubrication during intercourse. You can buy some that they have no perfume.
Okay, I was getting a question from Lori. She's asking about, she says that her intimate part is always very dry, and she's only using a body oil to wash her intimate part. So what is it that the dryness?
So the question is that she's using a body oil for washing her skin.
A body wash. I understand it's a body wash that is an oil. So body oil for washing. So what is it that she should do? What is it, the dryness? What is it that she should do or not do, or look at some ingredients maybe in that oil?
So first of all, she has to make sure that it doesn't have perfume, and two, she can use coconut oil in the vagina just to keep it moist. It's something very simple that many people have already at home. She doesn't have to buy anything different. Just use the baby oil or the coconut oil, and then you can use it for keep the vagina moist or the vulva moist. But usually when I see those products that it has a soap and the oil has perfume. So just the first thing that I will ask her is just to smell that it doesn't have perfume.
Okay, yeah, then very likely the body oil, the body wash with oil is there's fragrance in it. We have a question from Giselle that I'm actually putting up on the screen. If someone has odor that doesn't fit the usual categories, not fishy, no itching or pain lasting for months, how can they pinpoint what else could be causing it?
So one is to do the cultures. So you can visit your GYN and just to make sure it could be yeast, or it could be bacterial vaginosis, or it could be a different type of infection that we don't know about. When we do the swab on the cultures, we'll be able to figure it out. Let's pretend that it comes back negative, that everything is normal. So you can use something that is out of the counter in the store. The name is Refresh, and then you can use it, and that helps with the smell. Another option is to take vitamin C. You can take, usually the tablet comes in 500 milligrams, and you can take one daily so you can keep your body acidic.
So you take vitamin C like oral or topical?
What, one more time?
Vitamin C, you take like oral or topical? You apply on the intimate part?
That's a quick question. Oral, by mouth.
Oral. And how much did you say we should take every day, daily dose?
500 milligrams. Usually the tablets comes in 500 milligrams.
Okay. And there's one product that we have on Boutique that's Regi Cream, a vulva moisturizer. Is that something that you recommend to use every day, every other day, or is that something that you recommend women to do?
For daily use?
For if there's a dry area or some treatment or some, yeah.
So it depends. So if the patient is in menopause, they're going to have some dryness because of a lack of estrogen. So some people are feeling dry all the time, so they can use A&D, that is the ointment they buy for children. They can use coconut oil, or they can use the product that you have that is good and it has no that many chemicals. If the patient sometimes feel dry only during intercourse, then they can only use the lubricant during intercourse. There is a natural product that is also promoted by a company that it has hyaluronic acid, that it has a suppository that they can use twice a week. So for patients that they can't have any estrogen because they have a history of breast cancer, for example, they can use it. It's a suppository of hyaluronic acid. They can use it twice a week. Okay.
And something you said about, so you mentioned vitamin C, hyaluronic acid, no fragrance. But is there something we should use specifically in the shower for washing? We should use the same product as we use for the rest of the body. What do you advise for this use?
So that's my recommendation. If you have a soap that it has no perfume and you have a body wash, the same product, it will be easier. Some people use the body wash that it has a lot of perfume for the rest of the body and a different one for the genital area. But I always believe that when you put soap here, it runs down, and some of them is going to be in the vagina. And some people have more sensitive skin, more sensitive than others, and some of them are going to have more issues than other patients that they sometimes wash every day and they have no complaints.
Okay. Anything you can pinpoint when it resembles an infection, when it gets like the symptoms are, I would say, serious enough that you think as an OBGYN as of an infection? What are the sort of like the markers, what pinpoints you toward the signs of infection?
So two things or three things. One is the smell. You have the fishy smell or different smell. People just say, I don't know what it is, but it's not my normal smell. So when it's a change in the odor, is a significant sign of infection. Two, that you have any itchiness, that is itching and is uncomfortable, is irritated. And the third one is the consistency of the discharge. So a lot of times it's the color, could be greenish, yellowish, or the common cottage cheese, like for the yeast. But a lot of times people have the discharge, but because they're cleaning too much, it's a mucosa, they produce more mucus. So when they just clean and clean, that's just gonna cause more discharge.
Okay. And that menopause situation, does it like trigger? You said that we are the skin is getting thinner, we have less estrogen and all, but is that also a moment where, or phase when you're going through menopause, that's going to mean that you have some abnormal smell? Is there any sort of physical behavior and thing happening linked to the process of menopause?
Yeah, so when menopause, most women are going to be atrophy. They're going to become so thin the outside, and it becomes getting smaller and tight. So the lubricants usually helps to go in and out during penetration, but it doesn't help with elasticity. So the replacement for the estrogen with a cream or the hyaluronic acid, it helps with the elasticity. So the dryness can cause the recurrent yeast infections or recurrent infections in general, not only the yeast, but also sometimes they said, I took the medication and it's still uncomfortable because it takes longer, the mucosa, to heal.
And during pregnancy, is there any sort of like things happening down there that should be considered as totally normal?
Yeah, so in pregnancy, the pH changed because the body is perfect and then just trying to protect the cervix and the baby. So normally they produce a lot of discharge, and that's normal. Only when it starts having some symptoms, that's when we become concerned. But most of the times it's a lot of discharge, but it's normal. It's
Okay.
part of the pH change and the immune system changed in order the mother to not react to the baby.
Yeah. We have a pretty technical question from Haley. Hey, Haley. She's a technician, so that's why you can see the question is coming from a technician. So I let you read it. But this vitamin C thing and the acidity.
Yes, so that's very good. So a lot of is a new thought that the alkaline, especially the water. So and it's a specific water that the people drink that is more alkaline than the regular water. And in that sense, it is good for metabolism. But in this case, we just try to keep the vagina acidic, that is a mucosa. So your mouth is not going to be acidic. It's more concentrate in the vagina when people take vitamin C. And you can see the vitamin C also increase the immune system, but it's not a direct relationship because of the immune system. It's because your body becomes a little bit acidic. But it works in a different way. You can see different groups that they say that the alkaline water is better for better metabolism. The physiology for some of the vitamins and some of the hormones to be formed is better in the alkaline, but some of them are in the acidic environment. So it's just different. So we know that the infections, when we have vitamin C, fights better. And in the vaginitis, the chronic vaginitis, some of them, it improves with the vitamin C.
Okay. I hope this answers Helly's question, and I guess it does. So I think this is it for the questions tonight. Well, thank you very much, everybody, for attending. Thank you, Dr. Angelica Hernandez. Thank you so much. Merci beaucoup.
Bye-bye, everyone. We'll see you soon.
So everyone, thank you. And we're going to have more events with Dr. Angelica Hernandez treating other aspects of sexual wellness, women's health. So stay tuned. And our next event is actually tomorrow. We have two branded events. One with Dome Beauty, talking about clean mascara and clean beauty in general. And at night at 6 p.m. Eastern Time, we have Erika Supa, who's a skin scientist, licensed esthetician, and the founder of Fresh Face Skincare, talking about aging and acne at the same time and how to treat it. So a lot of women health issues that we're talking about between tonight down there with Dr. Angelica Hernandez, up here tomorrow with our wonderful brands. So guys, come join us tomorrow, and we wish you a very good evening. Stay safe, be well, and if you have any questions for Dr. Hernandez, let us know. Drop us a question on our website. I mean, you have our email, and she will be happy to answer, as long as it's not medical related. She cannot give any medical advice, only has to be hygiene related. So we will make sure that we come back to you. And one last thing I want to say is that whatever product she mentioned, so those are products that she advises without any affiliation. So that's something you have to know. So thank you so much again. Everybody have a wonderful night, and we'll see you guys very soon.
Bye-bye.